treatment once it's been started, such as a respirator, even when in a coma, and a rabbi should be contacted to provide religious rituals for death. Before the actual death, there is a final confession and affirmation of faith with prayers that continue after death. Since many healthcare facilities do not employ a rabbi in their chaplain services, medical staff needs to make sure that they have open communication about who or what the family prefers in the event of a patient's death. Some Jewish patients may have some reluctance to donating organs due to the belief that the human form is made in the image of God and should be buried in its entirety. Anyone working with a Jewish patient and their loved ones should be very sensitive to beliefs and simply inform the patient of options and not apply too much pressure as to respect religious wishes. After death, some people may be upset if an autopsy is requested, because autopsies are seen as a desecration of the body. And if law requires it, Jewish faith requests the invasiveness be minimal and all organs are returned to the body afterwards. Islam is the third Abrahamic religion, which has many rituals that are commonly misunderstood in recent years, but are just as important and vital to understand. In the Muslim world, physicians are considered to be God's agents with the power to heal, and nurses are their helpers, so healthcare is very respected. The Quran states every illness has a cure, so medical professionals are challenged to find it. The Quran also states people should live hygienically with toothbrushing, exercising, breastfeeding, and hand washing in order to lead lives that are not full of disease, which is classified as preventive medicine. Islamic individuals may have dietary restrictions against pork and alcohol, and very traditional diet says to have 1/3 food, 1/3 water, and 1/3 air to maintain dietary moderation. Like in Judaism, Islam followers are forbidden by God to eat the meat of the pig, pork. This is detailed in verses of the Quran, and an exemplary collection of these verses are: He has only forbidden you to eat dead meat, and blood, and the flesh of swine, and any food over which the name of other than Allah has been invoked. But if one is forced by necessity, without willful disobedience, or transgressing due limits, then Allah is oft forgiving, most merciful. Therefore, the use of alcohol or pig-based medications is only permitted for life and death situations, and for some very traditional followers, they still may refuse the treatments, which is within their medical rights. Traditional Arabic doctors are hakims, which means wise and knowledgeable person. Many will use herbal medications, homeopathy, naturopathy, chiropractic, and other varied traditional practices for healthcare. In some instances, the family or the patient may request or have taken certain remedies that are not commonly discussed. Some of these medications or practices may interact with some newly administered medications or recommended procedures. It is crucial to ask about traditional practices, herbs, etc. when doing an admission assessment to ascertain all appropriate knowledge to reduce the risk of complications. Some herbs or natural remedies are known to have interactions with drugs that could be deadly for the patient or medical personnel in the vicinity. Some Muslims may refuse procedures to prolong life beyond what God has ordained, such as a respirator, and it is very important to discuss these procedures, options, and if a DNR order should be placed to prevent unwanted medical actions from being taken. However, the majority of Islamic followers do believe in modern medical techniques, so one should never assume that they do not want a certain procedure or are uneducated about special techniques. Some Muslim patients may also refuse to accept or give organs due to the idea it is the desecration of the body and focusing on its sanctity. This very delicate topic must be discussed but not forced upon anyone. Sexual health may be influenced since sexual enhancing drugs are only for impotency problems within the marriage. The majority of Islamic faiths do not have a problem with using contraceptives, and abortion is acceptable to save the mother. Death and preparing the body for burial rituals are done by religious figures or hospital personnel. Autopsies are not preferred and only done if absolutely necessary. The religion known to the Western world as Hinduism is called Sanatana Dharma by its followers. For Hindu followers, preventative medicine is very important, and food is the best means in which to care for the body. It is very important for Hindus to follow a vegetarian diet, to avoid consuming meat, since they believe they would be consuming reincarnated beings that could bring bad karma. As a means to prevent sickness, exercise is encouraged and daily yoga and meditation are very important. The religious texts, the Upanishads, speak of a universal spirit, known as Brahman, and an individual soul, known as Atman, and at times assert the identity of both. Teachings and stories stress to take care of yourself and others, since all are connected as one. Verses 6, 7, and 8 of the Isha Upanishads: whoever sees all beings in the soul, and the soul in all beings. What delusion or sorrow is there for one who sees unity? It has filled all. It is radiant, incorporeal, invulnerable, wise, intelligent, encompassing, self-existent. It organizes objects throughout eternity. In order to stress that all is important and all is connected in one's soul, one must take care of itself and all else, since the world is connected in the Brahman or universal spirit. Hinduism stresses Ayurveda preventative measures with administering healthy foods and focusing on mental and physical exercise, as previously mentioned. Ancient practices combined with Western medicine is widely used. It is especially important to ask patients what homeopathic and Ayurvedic practices they use to avoid potential complications, as was stressed when working with patients of other faiths. For Hindu patients, there are many possible cultural differences, so many topics should be discussed and understood thoroughly. Any medications made of animal products are not acceptable, since they invite bad karma due to consuming a living thing. Most Hindus do not donate their organs because they do not know how it will affect them in their upcoming lives. But since transplants were not invented when the religion was founded, it is not covered in the Vedas, so there are no actual texts regarding the subject. As in many other religions, autopsies are not preferred and only done if required by law. Birth control is considered acceptable, but sex should only be within a marriage, and abortions are not allowed unless to save the mother. Hindus believe birth and death is predestined, and after death, the spirit goes to its God for 365 days. The person will be called to account for the actions of their life, and will be decided what the person will be reincarnated as and for how long. No matter what, it is believed that death will occur as its predestined date, no matter what. And many prefer a quick death, such as a heart attack, to a slow death to an illness, such as cancer. Upon death, prayers and rites are performed, the body is cremated, and remains are spread in water. According to Richard Johnson, an RN and teacher of meditation at the Friends of the Heart facility in Toronto, Canada, some Buddhist followers believe that 80% of the time, sickness can be cured by using the mind, and only 20% need a medicinal supplement, such as herbs. Other Buddhists also believe that exposing the body to harsh natural elements will strengthen the immune system, so some other attribute sickness to being lazy. Some Buddhists may dislike the ICU since it is usually bright, loud, and full of activity to monitor patients, so it cannot create the quiet environment in which the spirit needs to heal. Most Buddhists are vegetarian, like Hindus, since they believe they may be reincarnated as animals, so they refuse to eat the meat, and medications with animal products may be refused. Buddhist teachings state that there is no self and every living thing is connected, so after death, a being becomes a new form, such as an animal or person, and will continue to switch bodies upon death, until reaching the ultimate destination between existence and non-existence, known as nirvana, when the chain is finally broken. The three jewels, or refuges, state, I take refuge in the Buddha, in his Dharma, his teaching, in the Sangha, his communities of. This passage supports the idea to be Buddhist means you accept the Buddha as teacher and a way to guide your life. For Buddhists, organ donation can only take place once a religious teacher confirms the spirit has left the body. Sex is only within marriage, and birth control is a personal choice. Buddhists are against violence, and some may accept abortion for the mother's sake, but others will refuse it entirely. The choice is entirely personal, and all options must be clearly explained without judgment. Buddhism is a non-killing tradition, and killing another living thing is only considered acceptable when morally justifiable, as to protect others, and since abortion does not fit this criteria, it is not accepted. Death offers enlightenment, so the mind should not be clouded by drugs, and many Buddhists will ask that the patient's medications be lessened or stopped entirely so the mind and soul can be unhindered. Traditions may ask the body be untouched for as long as allowed by the hospital or for days in the home. To ensure the spirit will be undisturbed, very few visitors are allowed to see the deceased person, and grief may not be openly expressed. The body is usually cremated after 5 days, and then a memory service is held 49 days after the patient's death. There have been countless debates over the value of religion in the scientific community. However, being a healthcare provider, I know from my own experiences that anything anyone can do for a patient to recover quicker or to allow them to be in better spirits during illness is beneficial and should be explored. Religion is something that countless cultures throughout history have depended upon and developed to help their cultures survive. By learning more about different religions, healthcare providers can be more supportive and sensitive to different patients'